Discuss the key components of a mental status examination, MSE, and their significance in psychiatric assessments. Answer: the mental status examination, MAE, is a critical tool used to evaluate a patient's psychological functioning. The MSE includes several components. Appearance. Observing the patient's physical appearance, grooming, and attire can provide insights into their mental state. Disheveled appearance may indicate a lack of self-care, often seen in depressive disorders. Behavior. This assesses the patient's level of cooperation, agitation, or psychomotor retardation. For instance, a patient who is unresponsive may be experiencing catatonia. Speech. Evaluating speech includes rate, volume, and coherence. Rapid speech might suggest mania, whereas slow speech could indicate depression. Mood and affect. The patient's reported mood, subjective, and observable affect, objective, help assess emotional states. A mismatch, e.g., flat affect with reported euphoria, can indicate mood disorders. Thought process and content. This examines the organization of thoughts and the presence of delusions or obsessions. Disorganized thought processes may be indicative of psychosis. Cognition, assessing orientation to person, place, time, attention, and memory, provides information about cognitive functioning. For example, impaired orientation could suggest delirium or a cognitive disorder. Insight and judgment. Evaluating how well the patient understands their condition and their decision-making ability is vital for treatment planning. The MSE is crucial for diagnosing psychiatric disorders, formulating treatment plans, and monitoring progress. What are the ethical considerations involved in conducting clinical trials in psychiatric research? Answer: ethical considerations in psychiatric clinical trials are governed by several key principles. Informed consent. Participants must be fully informed about the study's purpose, procedures, risks, and benefits. This is outlined in the Belmont Report, emphasizing autonomy and the right to make informed decisions. Risk-benefit analysis. Researchers must ensure that the potential benefits of the research outweigh the risks to participants. The U.S. Department of Health and Human Service (HHS) regulations require this assessment. Confidentiality. Protecting the privacy of participants is essential. Researchers must implement measures to secure personal data and comply with HIPAA regulations. Vulnerable populations. Special care is needed when research involves vulnerable populations, e.g., individuals with mental illness, as they may have diminished capacity to provide consent. Ethical guidelines necessitate additional protections, such as involving a guardian in the consent process. Review by an institutional review board. All research protocols must be reviewed and approved by an IRB to ensure ethical standards are upheld, focusing on participant safety and rights. Compare and contrast structured and semi-structured interview techniques in psychiatric assessments. Answer: structured and semi-structured interviews are both essential techniques in psychiatric assessments, each with its distinct characteristics. Structured interviews. These involve a standardized set of questions that are asked in the same order for all participants. This approach minimizes variability and enhances reliability, making it easier to compare results across different individuals. An example is the SCID structured clinical interview for DSM-5, which is used to diagnose psychiatric disorders based on DSM criteria. However, structured interviews may limit the depth of responses and the ability to explore complex issues. Semi-structured interviews. These provide flexibility, allowing clinicians to explore topics in greater depth while still following a general framework. Clinicians can adapt questions based on the patient's responses, which can lead to richer qualitative data. For instance, the MINI Mini International Neuropsychiatric Interview offers a structured guide but allows clinicians to probe further on relevant topics. The flexibility in semi-structured interviews can uncover nuances in a patient's condition that structured interviews might miss. Ms. Thompson is a 45-year-old woman presenting with symptoms of severe anxiety and insomnia. After conducting a mental status examination, you notice her thoughts are racing and she has difficulty concentrating. Considering her symptoms and your assessment, what would be the most appropriate initial intervention you should recommend? Answer: given Ms. Thompson's symptoms of severe anxiety, insomnia, racing thoughts, and difficulty concentrating, an appropriate initial intervention would be to consider a combination of pharmacological treatment and psychotherapy. Pharmacological treatment. Initiating a selective serotonin reuptake inhibitor esteries such as sertraline or escitalopram could help manage her anxiety symptoms effectively. SSR is a first-line treatment for anxiety disorders and can alleviate symptoms over time. If her insomnia is significantly impacting her daily functioning, a short-term prescription for a sleep aid, such as a benzodiazepine or a non-benzodiazepine hypnotic, might be warranted while the SSRI takes effect. Psychotherapy. Cognitive behavioral therapy (CBT) should also be recommended concurrently as it has shown efficacy in treating anxiety disorders. CBT can help MS. Thompson developed coping strategies, challenge irrational thoughts, and address the underlying issues contributing to her anxiety. This combined approach addresses both the immediate symptoms and the underlying anxiety disorder, promoting long-term recovery. Describe the DSM-5 criteria for diagnosing major depressive disorder and discuss the significance of distinguishing it from other mood disorders. Answer: the DSM-5 criteria for diagnosing major depressive disorder (MDD) include the following. 5 or more of the following symptoms must be present during the same 2-week period and represent a change from previous functioning. Depressed mood most of the day, nearly every day. Markedly diminished interest or pleasure in all or almost all activities. Significant weight loss when not dieting, weight gain or increase in appetite, insomnia or hypersomnia nearly every day, psychomotor agitation or retardation, fatigue or loss of energy, feelings of worthlessness or excessive inappropriate guilt, diminished ability to think or concentrate, recurrent thoughts of death, suicidal ideation or a suicide attempt. Symptoms cause clinically significant distress or impairment in social, occupational, or other important areas of functioning. The episode is not attributable to the physiological effects of a substance or another medical condition. Distinguishing MDD from other mood disorders, such as bipolar disorder, is critical because treatment approaches differ significantly. MDD is treated primarily with antidepressants and psychotherapy, while bipolar disorder often requires mood stabilizers or antipsychotics. Misdiagnosis can lead to inappropriate treatments and worsen the patient's condition. Accurate diagnosis ensures that patients receive the most effective and appropriate care for their specific mood disorder. What are the primary risk factors for developing schizophrenia, and how do they interact with environmental factors? Answer: the development of schizophrenia is influenced by a complex interplay of genetic, biological, and environmental factors. Genetic factors. A family history of schizophrenia significantly increases an individual's risk. Studies indicate that individuals with a first-degree relative, parent, or sibling diagnosed with schizophrenia have a tenfold increased risk compared to the general population. The heritability of schizophrenia is estimated to be around 80%, suggesting a strong genetic component. Neurobiological factors. Abnormalities in brain structure and function, such as enlarged ventricles and reduced gray matter, have been observed in individuals with schizophrenia. Neurotransmitter systems, particularly dopamine dysregulation, are also implicated in the disorder's pathophysiology. Environmental factors. Exposure to certain environmental stresses, especially during critical periods of brain development, can increase the risk of schizophrenia. Factors include prenatal exposure to infections, malnutrition, or stress, as well as psychosocial stresses during adolescence. Urban living, substance abuse, especially cannabis, and traumatic experiences can also act as significant environmental triggers. The interaction between genetic predisposition and environmental stresses underscores the biopsychosocial model of schizophrenia, indicating that both biological vulnerabilities and external influences play crucial roles in the disorder's onset and progression. Explain the concept of effect size in research studies and its relevance in the field of psychiatry. Answer: effect size is a quantitative measure that reflects the magnitude of a phenomenon or the strength of a relationship between variables in research. It provides insight into the practical significance of findings beyond mere statistical significance, p-values. In psychiatry, effect size is crucial for interpreting clinical research outcomes and informing treatment decisions. Types of effect size. Commonly used measures include Cohen's d, which indicates the standardized difference between two means, and Pearson's r, which measures the strength of the relationship between two variables. For instance, a Cohen's d of 0.2 might indicate a small effect size, 0.5 a medium effect size, and 0.8 a large effect size. Clinical relevance. In psychiatric research, knowing the effect size helps clinicians understand the real-world implications of study results. For example, if a new antidepressant shows a large effect size in reducing depressive symptoms, it suggests that the treatment is likely to produce meaningful improvements for patients, making it a viable option for clinical use. Systematic reviews and meta-analyses. Effect sizes are also critical in synthesizing research findings across studies. Meta-analyses aggregate effect sizes from multiple studies to provide a more comprehensive understanding of treatment efficacy and inform evidence-based practice. Effect size thus serves as a vital metric for evaluating and comparing the effectiveness of interventions in psychiatric Research. Dr. Smith is conducting a study on the efficacy of a new psychotherapy technique for treating generalized anxiety disorder, GAD. He plans to recruit participants who have not previously undergone therapy for GAD. What ethical considerations should Dr. Smith take into account when designing his study? Answer. Dr. Smith must consider several ethical considerations when designing his study. Informed consent. He should ensure that all participants provide informed consent. This means clearly explaining the study's purpose, procedures, potential risks and benefits. Vulnerability of participants. Since the study focuses on individuals with GAD who may be vulnerable, special attention must be given to their mental state. Dr. Smith should consider implementing additional safeguards, such as providing access to mental health support during the study. Risk-benefit analysis. Dr. Smith must evaluate the potential risks associated with the new psychotherapy technique against the anticipated benefits. If the therapy is experimental, he should be particularly cautious about the psychological risks involved. IRB review. The study must be reviewed and approved by an institutional review board to ensure that ethical standards are met and that the study design adequately protects participants. Confidentiality. Dr. Smith should have a plan in place to protect the confidentiality of participant data, including secure storage and limited access to sensitive information. What is the significance of critical appraisal in the context of evidence-based medicine (EBM) in psychiatry? Answer. Critical appraisal is a fundamental component of evidence-based medicine (EBM) and involves systematically evaluating research studies to determine their validity, reliability, and applicability to clinical practice. In the context of psychiatry, critical appraisal is essential for several reasons. Assessment of quality. It enables clinicians to assess the quality of evidence from studies, identifying potential biases, limitations, and the robustness of findings. This is crucial in psychiatry, where treatment efficacy may vary widely among individuals due to the complexity of mental health conditions. Informed decision-making. By appraising the evidence, clinicians can make informed treatment decisions tailored to individual patient needs. For instance, understanding the strength of evidence for a particular antidepressant versus psychotherapy allows for better patient-centered care. Staying updated. Psychiatry is a rapidly evolving field. Critical appraisal encourages clinicians to stay current with the latest research, allowing them to incorporate new findings into their practice effectively. Integration of evidence with clinical expertise. EBM emphasizes integrating the best available research evidence with clinical expertise and patient preferences. Critical appraisal facilitates this integration, ensuring that clinical decisions are grounded in high-quality evidence. Overall, critical appraisal is vital for advancing psychiatric practice, improving patient outcomes, and ensuring that treatments are based on sound scientific evidence. Describe the principles of evidence-based practice and how they apply to the treatment of psychiatric disorders. Answer. Evidence-based practice in psychiatry is founded on three core principles. Best available evidence. BP emphasizes the use of the best available research evidence in clinical decision-making. This involves utilizing systematic reviews, randomized controlled trials, and meta-analyses to inform treatment options for psychiatric disorders. Clinical expertise. Clinicians' clinical expertise plays a crucial role in BP. Their experience, education, and skills enable them to interpret research findings within the context of individual patient circumstances. Patient preferences and values. BP prioritizes patient involvement in treatment decisions, acknowledging their preferences, values, and cultural considerations. This approach promotes shared decision-making, where clinicians and patients collaborate to select treatment options that align with the patient's goals and lifestyle. In the treatment of psychiatric disorders, these principles guide clinicians in selecting interventions that are evidence-based, effective, and tailored to individual patient needs. This holistic approach improves treatment adherence and enhances patient outcomes. Describe the role of dopamine in the brain's reward pathways and its relevance to addiction. How does dysregulation of dopamine contribute to the development of addictive behaviors? Answer. Dopamine, a neurotransmitter produced in several brain regions, including the substantia nigra and the ventral tegmental area (VTA), plays a pivotal role in the brain's reward circuitry. The mesolimbic dopamine pathway, particularly the connection between the VTA and the nucleus accumbens, is crucial for the experience of pleasure and reinforcement of behaviors. When a rewarding stimulus, such as food or drugs, is encountered, dopamine levels surge, creating feelings of euphoria and reinforcing the behavior associated with the stimulus. In addiction, substances like cocaine and heroin hijack this natural reward system. For example, cocaine blocks the reuptake of dopamine, resulting in excessive accumulation in the synaptic cleft, leading to prolonged activation of the dopamine receptors. Over time, repeated exposure to drugs leads to neuroadaptation, where the brain's reward system becomes less responsive to natural reinforcers, requiring greater amounts of the substance to achieve the same effect, known as tolerance. This dysregulation can also result in a decrease in the number of dopamine receptors, downregulation, or a blunted release of dopamine in response to natural rewards. The chronic pursuit of substances over natural rewards drives compulsive drug-seeking behaviors characteristic of addiction. This shift in motivation and behavior can be further complicated by genetic predispositions, environmental influences, and stressors, all of which interact with the dopamine system to enhance the risk of developing an addiction. Overall, the profound impact of dopamine on both reward and reinforcement highlights its critical role in the pathology of addiction, underscoring the need for therapeutic interventions that can restore the balance of this neurotransmitter system. Explain how genetic predispositions can impact the risk of developing mental health disorders. Which psychiatric disorders are most strongly associated with genetic influences? Answer: genetic predispositions are fundamental in understanding the etiology of many mental health disorders. Research suggests that genetics can account for a significant portion of the risk for various psychiatric conditions. Heritability estimates, which reflect the proportion of variance in a trait attributable to genetic factors, are particularly high for disorders such as schizophrenia, bipolar disorder, and major depressive disorder, with estimates ranging from 40% to over 80%. Schizophrenia exemplifies a disorder with strong genetic links. Individuals with a first-degree relative diagnosed with schizophrenia have an approximate 10% chance of developing the disorder compared to just 1% in the general population. This elevated risk suggests the presence of multiple genes that may confer vulnerability, alongside environmental factors that can trigger the onset of symptoms. Bipolar disorder also has a notable heritability rate, with family studies indicating that if one twin has the disorder, the likelihood of the other twin developing it can be as high as 70%. This has led to the hypothesis that variations in specific genes, including those involved in neurotransmitter regulation, such as serotonin and dopamine, could play a role in the disorder's manifestation. Major depressive disorder, while influenced by environmental stressors, also shows strong genetic correlations. Twin studies have estimated the heritability of major depressive disorder at about 37%. These findings emphasize the need for a biopsychosocial approach in treatment, considering both genetic vulnerabilities and environmental factors such as trauma, stress, and lifestyle choices. Understanding genetic predispositions not only aids in risk assessment, but also in the development of targeted treatments that may consider an individual's genetic profile. Dr. Emily Carter has a patient, Mr. Ramirez, who struggles with alcohol use disorder, or he has previously attempted to quit but relapsed due to withdrawal symptoms and cravings. Mr. Ramirez is open to medication but prefers to avoid hospitalization. What pharmacological and psychosocial interventions should Dr. Carter consider to maximize Mr. Ramirez's chances of achieving and maintaining sobriety? Answer: in managing Mr. Ramirez's alcohol use disorder, or Dr. Carter should implement a comprehensive treatment plan that combines both pharmacological and psychosocial interventions to address the complexity of his condition while allowing him to remain in an outpatient setting. For pharmacological treatment, Dr. Carter could consider naltrexone, which acts as an opioid receptor antagonist. It reduces cravings for alcohol and mitigates the rewarding effects of alcohol consumption, helping to prevent relapse. Another viable option is acamprosate, which works to stabilize neurotransmitter imbalances in the brain, particularly those affected by chronic alcohol use, thus reducing cravings and the risk of relapse. Camprosate is particularly effective for patients who have already detoxified and are in recovery. In addition to pharmacotherapy, psychosocial interventions are critical in providing Mr. Ramirez with the necessary support and coping strategies. Cognitive behavioral therapy (CBT) can be particularly beneficial as it helps individuals identify and change negative thought patterns associated with drinking. CBT also teaches coping skills to manage triggers and high-risk situations. Motivational interviewing can enhance Mr. Ramirez's intrinsic motivation to change by exploring his ambivalence towards recovery and reinforcing his commitment to sobriety. This client-centered approach can empower him to take an active role in his recovery process. Support groups, such as Alcoholics Anonymous, could provide Mr. Ramirez with a community of peers who share similar experiences, fostering accountability and support. Regular follow-up appointments would also be essential to monitor progress, adjust medications if necessary, and ensure that Mr. Ramirez feels supported throughout his recovery journey. Finally, integrating family therapy could strengthen support systems by involving significant others in the treatment process, helping to address any relational issues that may contribute to his alcohol use. This holistic approach, encompassing both pharmacological and psychosocial elements, will provide Mr. Ramirez with a robust framework to achieve and maintain sobriety. Discuss the concept of cultural competence in psychiatric care and why it is essential for effective patient outcomes. Provide examples of how cultural competence can improve treatment. Answer: cultural competence in psychiatric care refers to the ability of healthcare providers to understand, respect, and effectively respond to the cultural needs and preferences of diverse patient populations. It encompasses awareness of one's own cultural biases and understanding of different cultural beliefs and practices, and the ability to communicate effectively across cultural boundaries. The importance of cultural competence cannot be overstated, as it is linked to improved patient outcomes, higher satisfaction rates, and increased treatment adherence. When healthcare providers acknowledge and incorporate cultural factors into care, they create a therapeutic environment where patients feel understood and respected. This can lead to more accurate diagnoses, as cultural expressions of distress may differ significantly from Western psychiatric norms. For example, some cultures may view mental illness as a spiritual issue rather than a medical one. A culturally competent psychiatrist would be aware of this perspective and might involve traditional healers or family members in the treatment process. By respecting the patient's beliefs, the provider can enhance rapport and ensure that treatment is culturally acceptable. Furthermore, cultural competence can mitigate disparities in mental health care by addressing barriers such as language differences, mistrust of the healthcare system, and variations in help-seeking behaviors. For instance, a provider who speaks a patient's native language or uses interpreters can significantly improve communication and understanding, leading to better engagement and treatment adherence. Implementing culturally tailored interventions, such as integrating culturally relevant therapies or involving family dynamics in treatment planning, can further enhance the effectiveness of care. Ultimately, cultural competence fosters a more inclusive and equitable healthcare system, promoting better mental health outcomes for diverse populations. Describe how hormonal imbalances can affect mood and behavior, with a focus on the roles of cortisol and estrogen. How are these hormones linked to mood disorders? Answer: hormonal imbalances play a significant role in the regulation of mood and behavior, particularly through hormones such as cortisol and estrogen. Cortisol, often referred to as the stress hormone, is secreted by the adrenal glands in response to stress. While cortisol is essential for various bodily functions, chronic elevation due to prolonged stress can have detrimental effects on mental health. Elevated cortisol levels can lead to structural and functional changes in the brain, particularly in the hippocampus, which is vital for memory and emotional regulation. This can result in increased vulnerability to mood disorders, particularly anxiety and depression. Research has shown that individuals with major depressive disorder, MDD, often exhibit hypercortisolism characterized by elevated cortisol levels throughout the day. The dysregulation of the hypothalamic pituitary adrenal HEA axis, which controls cortisol release, is frequently observed in patients with depression. This dysregulation can impair the body's ability to cope with stress, exacerbate feelings of helplessness, and contribute to the development of depressive symptoms. Estrogen, on the other hand, has complex effects on mood and behavior. It influences the synthesis and release of neurotransmitters such as serotonin and dopamine, which are crucial for mood regulation. Fluctuations in estrogen levels, particularly during menstruation, pregnancy, and menopause, can lead to mood instability. For example, premenstrual dysphoric disorder (PDD) is characterized by significant mood disturbances related to hormonal changes during the menstrual cycle. During menopause, declining estrogen levels can contribute to mood swings, anxiety, and depression. Hormone replacement therapy (HRT) has been shown to alleviate some mood symptoms by stabilizing estrogen levels. Understanding the intricate relationship between hormonal imbalances and mood disorders highlights the need for a comprehensive treatment approach that considers both biological and psychological factors in managing mental health conditions. In the context of addiction, explain the concept of cross-addiction and provide examples of how this phenomenon can complicate treatment strategies. Answer: cross-addiction, also known as co-addiction or polysubstance addiction, refers to a situation where an individual becomes addicted to more than one substance or behavior. This phenomenon can complicate treatment strategies significantly, as the presence of multiple addictions can exacerbate the severity of each condition, increase the risk of relapse, and complicate the recovery process. For instance, a person recovering from alcohol use disorder may develop an addiction to prescription opioids, using them to cope with cravings or withdrawal symptoms from alcohol. The interplay between these substances can create a vicious cycle where the individual oscillates between the two addictions, making it challenging to achieve sustained sobriety. Similarly, someone who is addicted to nicotine may turn to alcohol as a way to enhance the effects of nicotine, further entrenching their substance use patterns. Cross-addiction complicates treatment because it requires clinicians to develop integrated interventions that address all addictive behaviors simultaneously. This often involves comprehensive assessments to identify all substances being abused and a tailored treatment plan that incorporates multiple therapeutic modalities. For instance, a patient in recovery from both alcohol and opioid addiction may benefit from a combination of behavioral therapies, medication-assisted treatment, MAT, for both substances, and support groups that address the challenges of cross-addiction. Furthermore, individuals with cross-addiction may face unique psychological and social challenges, such as co-occurring mental health disorders like depression or anxiety, which must also be addressed to improve treatment outcomes. Understanding cross-addiction is crucial for healthcare providers, as it emphasizes the need for holistic and multidisciplinary approaches in addiction treatment to support lasting recovery. Discuss the role of psychotherapy in the treatment of borderline personality disorder (BPD). What therapeutic approaches have shown the most efficacy for individuals with BPD? Answer: Psychotherapy is the cornerstone of treatment for borderline personality disorder (BPD), providing individuals with essential tools to manage their symptoms, improve interpersonal relationships, and foster emotional regulation. Several therapeutic approaches have demonstrated efficacy for BPD, each targeting different aspects of the disorder. Dialectical behavior therapy (DBT) is one of the most effective treatments for BPD. Developed by Dr. Marsha Linehan, DBT combines cognitive behavioral techniques with mindfulness practices. The therapy emphasizes the development of coping skills in 4 key areas: emotional regulation, distress tolerance, interpersonal effectiveness, and mindfulness. By teaching patients how to manage intense emotions and develop healthier relationships, DBT has been shown to reduce self-harm behaviors and improve overall functioning. Mentalization-based therapy (MBT) is another effective treatment specifically designed for individuals with BPD. This approach focuses on enhancing patients' ability to understand their own and others' mental states, thereby improving their interpersonal relationships. MBT helps patients develop insight into their emotional responses and behaviors, facilitating healthier interactions and reducing conflict. Transference-focused psychotherapy (TFP) is also utilized in treating BPD, focusing on the patient-therapist relationship as a way to explore and understand patterns of thinking and behavior. By examining the transference dynamics in therapy, patients can gain insights into their relationship patterns and work towards healthier interactions outside of therapy. Schema therapy is another approach that combines elements of cognitive behavioral therapy with aspects of psychodynamic therapy, targeting deep-seated emotional and relational patterns that contribute to BPD symptoms. This method focuses on identifying and modifying maladaptive schemas and beliefs developed in childhood. Overall, while psychotherapy remains the primary treatment for BPD, a comprehensive approach that may include medication for co-occurring conditions, such as anxiety or depression, is often beneficial. A multidisciplinary treatment plan involving individual therapy, group therapy, and support from mental health professionals is essential for effective management of BPD. Evaluate the impact of childhood trauma on the development of adult mental health disorders. What mechanisms contribute to this relationship? Answer: Childhood trauma has profound and lasting effects on mental health, significantly increasing the risk of developing various adult mental health disorders, including anxiety disorders, depression, personality disorders, and post-traumatic stress disorder (PSD). The mechanisms contributing to this relationship are multifaceted, encompassing biological, psychological, and social factors. Biologically, childhood trauma can alter neurodevelopment, affecting brain structures such as the amygdala, prefrontal cortex, and hippocampus, which are crucial for emotional regulation, stress response, and memory. These alterations can lead to heightened sensitivity to stress and emotional dysregulation in adulthood. For instance, individuals exposed to trauma often exhibit hyperactivity of the hypothalamic pituitary adrenal (HEA) axis, resulting in chronic stress responses that can predispose them to anxiety and mood disorders. Psychologically, childhood trauma can disrupt attachment patterns and hinder the development of healthy coping mechanisms. Adverse experiences may lead to maladaptive beliefs about oneself and the world, contributing to low self-esteem, feelings of worthlessness, and difficulties in interpersonal relationships. These psychological scars can manifest as symptoms of various mental health disorders in adulthood. Socially, individuals with a history of childhood trauma may encounter challenges in their environment, including dysfunctional family dynamics, socioeconomic instability, or exposure to violence, which can perpetuate the cycle of trauma and contribute to mental health issues. Social support systems often become compromised, leading to isolation and further exacerbating mental health struggles. Numerous studies underscore the correlation between childhood trauma and adult mental health outcomes, indicating that early interventions and trauma-informed care are essential for mitigating these risks. Therapeutic approaches that focus on processing trauma, building resilience, and developing healthy coping strategies can significantly improve outcomes for individuals affected by childhood trauma, highlighting the critical importance of addressing these issues early in life. Analyze the influence of socioeconomic status on mental health outcomes. How do factors like poverty and access to healthcare contribute to disparities in mental health? Answer: socioeconomic status significantly influences mental health outcomes, with numerous studies demonstrating that lower SE is associated with a higher prevalence of mental health disorders. This relationship is complex as it encompasses various factors, including income, education, and occupation, which interact to shape individuals' experiences and access to resources. Poverty is a primary driver of mental health disparities. Individuals living in poverty often face chronic stresses such as financial instability, inadequate housing, and food insecurity, which can contribute to anxiety, depression, and other mental health issues. The constant struggle to meet basic needs can create an environment of unpredictability and stress, exacerbating existing mental health conditions or contributing to their development. Access to healthcare is another crucial factor influencing mental health outcomes. Individuals from lower SES backgrounds often experience barriers to accessing mental health services, including lack of health insurance, transportation difficulties, and limited availability of culturally competent providers. This lack of access can delay treatment and exacerbate mental health issues, leading to poorer outcomes. Additionally, individuals with lower education levels may have less knowledge about mental health issues, which can impede help-seeking behavior. They may also encounter stigma associated with mental health conditions, further discouraging them from seeking necessary care. The intersectionality of these factors means that individuals from marginalized communities face compounded challenges. For example, people of color, particularly in lower SES brackets, are at a heightened risk for both discrimination and mental health disorders, further underscoring the need for targeted interventions that address these disparities. Addressing related mental health disparities requires comprehensive policy changes that focus on improving access to healthcare, enhancing economic stability, and promoting educational opportunities. Implementing community-based programs that provide mental health services in low-income areas can also help bridge the gap, ensuring that individuals receive the care they need to thrive. Explore the concept of resilience in mental health. How does resilience relate to coping strategies and recovery from mental health disorders? Answer: resilience in mental health refers to an individual's ability to adapt to adversity, trauma, and stress, enabling them to maintain or regain emotional well-being despite challenges. It is a dynamic process that involves a combination of personal characteristics, social support systems, and external resources that contribute to an individual's ability to cope with difficulties. Resilience is closely linked to coping strategies, as effective coping mechanisms can enhance resilience. Coping strategies can be classified into two broad categories: problem-focused and emotion-focused coping. Problem-focused coping involves taking proactive steps to address the source of stress, such as seeking solutions or support, while emotion-focused coping encompasses strategies aimed at managing emotional distress, such as mindfulness, relaxation techniques, or seeking emotional support from friends or family. Research has shown that individuals with higher resilience tend to utilize more adaptive coping strategies, such as positive reframing and seeking social support, which can mitigate the impact of stressors and enhance recovery from mental health disorders. Conversely, those with low resilience may rely on maladaptive coping strategies, such as avoidance or substance use, which can exacerbate mental health issues and hinder recovery. In the context of mental health disorders, fostering resilience can play a crucial role in recovery. Interventions that promote resilience, such as cognitive behavioral therapies, mindfulness training, and skills-building programs, can empower individuals to manage their symptoms more effectively, develop a sense of agency, and enhance their overall well-being. Additionally, building a strong support network can significantly contribute to resilience. Social connections provide emotional support, practical assistance, and a sense of belonging, all of which are critical for navigating the challenges associated with mental health disorders. Overall, resilience is a vital aspect of mental health that can facilitate recovery, improve coping strategies, and enhance quality of life, underscoring the importance of promoting resilience in therapeutic practices and community mental health initiatives. Mr. Johnson is a 78-year-old patient with early-stage Alzheimer's disease. His family has expressed concerns about his decision-making capacity regarding his treatment options. They want to make decisions on his behalf, believing it is in his best interest. What steps should Mr. Johnson's psychiatrist take to assess his capacity to make decisions, and what ethical principles should guide the psychiatrist's actions? Answer: the psychiatrist should begin by conducting a thorough capacity assessment, which involves evaluating Mr. Johnson's understanding of his condition, treatment options, and the consequences of his decisions. This assessment should be guided by the ethical principle of autonomy, which emphasizes the patient's right to make informed decisions about their care. Key steps include informed consent. The psychiatrist must ensure Mr. Johnson understands the relevant information. This includes explaining the nature of his condition, potential treatments, and outcomes. Capacity evaluation. Utilize tools like the MACAT Competence Assessment Tool for treatment to systematically assess Mr. Johnson's understanding, appreciation, reasoning, and choice. Family involvement. While the family can provide valuable insights, the psychiatrist should clarify that the final decision rests with Mr. Johnson, provided he has the capacity to make informed choices. Documentation. Thoroughly document the assessment process and findings to protect against potential legal challenges. Ethically, the psychiatrist must balance beneficence, acting in the patient's best interest with respect for autonomy. If Mr. Johnson lacks capacity, the psychiatrist should engage with legal standards regarding surrogate decision-making, typically requiring a court-appointed guardian or following advance directives if available. What constitutes malpractice in psychiatry, and how can a psychiatrist protect themselves from malpractice claims? Answer: malpractice in psychiatry occurs when a psychiatrist fails to provide the standard of care that a reasonable psychiatrist would provide under similar circumstances, leading to harm to the patient. Key components include duty of care. A psychiatrist has a legal obligation to provide care to their patients. Breach of duty. The psychiatrist must have deviated from accepted standards of care, which can involve misdiagnosis, improper treatment, or inadequate informed consent. Causation. There must be a direct link between the breach of duty and the harm suffered by the patient. Damages. The patient must demonstrate that they suffer measurable harm as a result. To protect against malpractice claims, psychiatrists can maintain comprehensive and accurate medical records, engage in continuous education to stay updated on standards of care, ensure clear communication with patients regarding treatment plans, risks, and alternatives, obtain informed consent, documenting the patient's understanding of their treatment. Discuss the ethical implications of conducting psychiatric research on vulnerable populations, particularly regarding informed consent and capacity. Answer: conducting psychiatric research on vulnerable populations, such as individuals with severe mental illness, poses significant ethical challenges. The following considerations are crucial. Informed consent. Researchers must ensure that participants fully understand the study's purpose, procedures, risks, and benefits. This is particularly challenging with individuals who may have impaired capacity to provide informed consent due to their psychiatric condition. Capacity assessment. It is essential to evaluate the participant's ability to comprehend the information and make an informed decision. Tools such as structured interviews or standardized assessment scales can assist in this evaluation. Protecting autonomy. Researchers should respect participants' autonomy by providing the opportunity to withdraw from the study at any time without any negative consequences. Ethics Review Board approval. Research involving vulnerable populations requires thorough review and approval by an institutional review board to ensure ethical standards are upheld. Confidentiality. Researchers must take extra precautions to protect the privacy of participants, especially regarding sensitive mental health information. What are the legal criteria for civil commitment in psychiatric practice, and how do they balance patient rights with public safety? Answer: civil commitment refers to the legal process by which individuals with mental illnesses can be involuntarily hospitalized if they meet specific criteria. The primary legal standards include mental illness. The individual must be diagnosed with a significant mental disorder that affects their functioning. Dangerousness. The individual poses a threat to themselves or others, demonstrating behaviors such as suicidal ideation, self-harm, or violence. Inability to care for self. The individual is unable to provide for their basic needs, which may include food, shelter, or medical care, thereby endangering their health and safety. The process involves a thorough assessment by a qualified mental health professional and often includes a court hearing. This legal framework aims to protect the individual's rights while addressing public safety concerns, reflecting the ethical principles of justice, fair treatment, and beneficence, acting in the best interest of the patient and society. Describe the common psychiatric disorders observed in geriatric populations and the unique considerations for treatment in this demographic. Answer: common psychiatric disorders in elderly populations include late-onset depression, characterized by depressive symptoms that arise later in life, often linked to loss, chronic illness, or social isolation. Treatment may involve antidepressants and psychotherapy, with careful monitoring for side effects due to polypharmacy risks. Anxiety disorders. Conditions such as generalized anxiety disorder or panic disorder can manifest differently in older adults. Treatment should consider non-pharmacological approaches such as cognitive behavioral therapy (CBT) alongside medication management. Dementia and neurodegenerative disorders. Conditions like Alzheimer's disease and vascular dementia require a multidisciplinary approach to care. Non-pharmacological interventions, including cognitive stimulation and caregiver support, are essential alongside medications like cholinesterase inhibitors. When treating geriatric patients, psychiatrists must consider physiological changes, comorbidities, potential medication interactions, and the need for a supportive environment to enhance treatment outcomes. Explain the duty to warn, protect, and the legal standards that psychiatrists must follow when they believe a patient poses a risk to others. Answer: the duty to warn, established in Tarasov v. Regents of the University of California, mandates that mental health professionals must take action if a patient poses a credible threat of violence to another individual. Key elements include assessment of threat. The psychiatrist must evaluate whether the patient has made a specific threat against a clearly identifiable victim. Professional judgment. The psychiatrist must use clinical judgment to determine the seriousness of the threat and the patient's intent, considering factors like history of violence, substance use, and current mental state. Taking action. If a credible threat is identified, the psychiatrist must take reasonable steps to protect the potential victim, which may include warning the intended victim, notifying law enforcement, hospitalizing the patient if necessary for safety. MS Smith, a 64-year-old woman with a long history of depression, requests assistance with euthanasia due to her persistent suffering and belief that she has no quality of life left. How should her psychiatrist approach this situation, considering ethical principles and legal guidelines? Answer: in this scenario, the psychiatrist must navigate complex ethical and legal considerations surrounding euthanasia and assisted suicide. Steps to take include assessment of capacity. Evaluate MS Smith's decision-making capacity to ensure she understands her situation, alternatives to euthanasia and the implications of her choice, the exploration of options, engage in discussions about her suffering, potential treatments, and palliative care options. This aligns with the principle of beneficence, emphasizing the need to alleviate suffering without hastening death. Legal considerations. Review state laws regarding euthanasia and assisted suicide, as these vary significantly. Some jurisdictions permit physician-assisted suicide under strict guidelines, while others prohibit it altogether. Ethical guidelines. Refer to the ethical principle of non-maleficence, which obligates the psychiatrist to avoid causing harm. If the psychiatrist believes that MS Smith's request arises from untreated depression, further psychiatric intervention may be necessary before considering any actions related to euthanasia. Documentation. Carefully document all discussions, assessments, and the rationale for decisions made in the context of MS Smith's care. Discuss the clinical features and treatment strategies for managing Alzheimer's disease in geriatric psychiatry. Answer: Alzheimer's disease is a progressive neurodegenerative disorder characterized by cognitive decline, memory impairment, particularly affecting short-term memory, and difficulties with language, problem-solving, and daily functioning. Behavioral and psychological symptoms. Patients may exhibit agitation, anxiety, depression, and changes in personality, necessitating comprehensive management. Treatment strategies include pharmacological interventions, cholinesterase inhibitors, G-donepezil, rivastigmine, used to enhance cognitive function by increasing acetylcholine levels in the brain. NMDA receptor antagonists, G-memantine, effective in moderate to severe AD to regulate glutamate activity, potentially improving symptoms. Non-pharmacological approaches, cognitive stimulation therapy, engaging patients in activities to enhance cognitive function and quality of life. Support for caregivers, providing education and resources to help caregivers manage the challenges of caring for individuals with AD. monitoring and adjusting treatment. Regular assessments to monitor the progression of the disease and the effectiveness of interventions are crucial to providing optimal care. Explain the concept of competency to stand trial and the factors that are considered in its assessment. Answer: competency to stand trial refers to the defendant's ability to understand the legal proceedings and assist in their defense. The legal standard established in Dusky v. United States includes understanding. The defendant must comprehend the nature of the charges against them and the possible consequences of a trial. Rationality. The defendant should be able to rationally engage with their attorney and understand the proceedings, which involves processing information and making reasoned choices. Factors considered in the assessment include the defendant's mental health history and current psychiatric status, the impact of any mental illness on the ability to understand and participate, the presence of cognitive deficits that might impair comprehension. Mental health professionals use structured interviews and standardized assessment tools, such as the Competency Assessment Instrument (KITE), to evaluate these factors. Describe the unique presentation of anxiety disorders in elderly patients and the considerations for treatment in this population. Answer: anxiety disorders in elderly patients may present differently than in younger populations, often co-occurring with medical conditions and cognitive impairment. Common features include physical symptoms. Elderly patients may report more somatic complaints, e.g., fatigue, muscle tension, rather than classic anxiety symptoms, complicating diagnosis. Cognitive decline. Anxiety can exacerbate cognitive impairment in conditions like dementia, leading to increased confusion and functional decline. Comorbid conditions. Anxiety often coexists with depression and chronic medical illnesses, requiring integrated treatment approaches. Treatment considerations include psychotherapy. Cognitive behavioral therapy (CBT) is effective with adaptations to address cognitive and sensory impairments. Pharmacotherapy. Selective serotonin reuptake inhibitors (SRIs) are commonly used, but careful monitoring for side effects is essential due to potential polypharmacy issues in older adults.